Hello, everybody, and thank you once again for joining us for another episode of imPOWERED, brought to you by Cancer Warrior Canada Foundation Canada. If you don't know me yet, my name is Rebecca Durrance-Hine, and I am a teacher, an actor, a cancer survivor and thriver, founder of Arenda Cancer Community and blog, and now your host for this evening. As always, we'd like to encourage you to participate in the broadcast tonight by commenting below the video, asking any questions that you might have, and we'll do what we usually do and reserve sort of 5 or 10 minutes at the end for any questions that come in throughout the show. So my guest tonight is Jean LaMantia. Jean is a registered dietitian, speaker, author, and a cancer thriver herself. After her own experience with lymphoma at the age of 27, Jean decided to put her education as a dietitian to work for her and figure out how she could best support herself post-cancer through diet changes. Now she works with cancer patients to find more well-being during and after cancer through nutrition and diet. Welcome, Jean. Thank you so much for being with me here tonight.
Well, thank you for inviting me, Rebecca. It's my pleasure to come on, and welcome, everyone. Thanks for joining us.
Wonderful. So let's get right to it and start with maybe a little bit of background information. So can you tell people a bit about your story, how you became interested in nutrition, and why you chose to focus so much on cancer in your practice?
You know, I was interested in nutrition from high school. And when I went to high school, we had grade 13 in Ontario. So that tells you all right. But I knew then, like, I wanted to study nutrition. So I went to the University of Guelph and I did a degree there. It's called Applied Human Nutrition. And then it's a rather competitive process. After the nutrition degree, you apply for an internship. So I was fortunate enough to get an internship, what's called a clinical dietetic internship. And I did mine at the Toronto Western Hospital. Beautiful. So I was actually a very young dietitian. A lot of the new dietitians, you know, they came into nutrition from very circuitous routes. Like some did, chemistry first and then kinesiology. But I just I knew I was very intrigued by nutrition. And I was already a registered dietitian when I was diagnosed with cancer. So I was, had been a registered dietitian for a few years. And yeah, as you said, at 27, I got my diagnosis.
Wow. So then obviously that had an impact on where you focused your
practice. Not right away, because I don't know, it was almost like it was too close.
Yes.
You know, and my first job after completing, I hadn't even finished all my treatment. I still had to do my radiation, but I got a job with the Victorian Order of Nurses, which is a home visiting nursing association, but they did hire dietitians. And so I remember going into the home and it was hard to talk about it, you know, because it was just too new.
Yes.
But what I recognized actually is that, you know, there was this real transformation that happened when my treatment finished, oddly enough. And, you know, you look so forward to that treatment finishing, but people don't tell you or talk so much about the fact that it can actually be a bit of a letdown. And what I found, like, you know, during my chemotherapy, especially, and that was 6 months, I developed a relationship with the nurses. And at that time, they had a primary care nurse that worked with my medical oncologist and the pharmacist. And, you know, it had this kind of a very, I almost want to say, social element, you know, like it was
definitely
not unpleasant, even though, like, you know, getting the needles and like
not fun,
you know, the chemicals, and you felt terrible. And then, you know, when that's all gone, it's like, okay, see you in 2 months. Yeah. And it's funny, when I attended my very last radiation appointment, I got this idea in my mind that when they opened those big lead doors and I came out, that my radiation oncologist would be there and he'd shake my hand and he'd say, "Congratulations,
good job."
You're right? Doesn't happen that way. Which, you know, now when I say it, like, how naive was that?
Right.
That was my expectation going to that last appointment. And so I was really like, that's it? You know,
anticlimactic.
And so then I thought, oh, at the follow-up appointment, he's too busy to come down.
Right.
He'll see me at the follow-up. And so, yeah, at the follow-up, I did the chest x-ray, I did blood work, he did the physical exam. He said, okay, I'll see you in 3 months. And I'm like, wait a minute, where's the part where you tell me I'm cured, right?
Yeah.
And so I developed a lot of anxiety, and I developed a lot of, I would call it hypervigilance, like to the point where every little whatever in my body, I thought, oh my God, it's back, it's back, it's back. I have a recurrence. One time I had some alcohol, the first alcohol I'd had since my treatment finished, and I got a headache. And I was so convinced I had brain mets. I called the hospital and I said, you got to page the oncology resident for me. And I said, you know, I'm a Hodgkin's patient. I've had my first alcohol. Now I have this headache. I think I have brain mets. And he laughed at me.
Oh,
this was the funniest thing. And it was so humiliating. And you know what it was like terrible on his part to brush away my fears like that. But at the same time, it was kind of a wake-up call. It's like, Jean, you got to get a grip. Like, you are out of control, girl. So that's maybe the point at which I started like reading more, and my science brain started kicking in. And it actually planted a seed. It said, you know, someone should create a food guide for people who've had cancer. Because all my oncologist said was, you know, just eat a healthy diet. And I thought, okay, Canada's food guide, right? But that did nothing to reduce my fear, because I thought, but my dietary needs are different because I've had cancer. I should have something that's
specific
for me, right? And anyway, fast forward several years, I created the guide because no one else was doing it. So
Wow, that's really, you describe it perfectly. I feel the exact same way. I had Herceptin, which is a year-long treatment, and you're there every 3 weeks in the chemo ward, and same thing. I walked out and was like, what? It just felt so, it was scary. I was scary. And it was this weird dichotomy of emotions, like being happy that you were done, but also not being happy at all. Like just being really scared.
Like,
you're
on a trapeze without a net.
Yes. Yeah. And so then, you start looking for all those things that you can do to make yourself feel better, feel less anxious. So for you, that was food. That's great. So in your work, you talk about the 3 keys to cancer reduction when it comes to diet and nutrition. And so I'd really like to get into each one of those. And the first one is to support the immune system. So can you explain the significance of, supporting your immune system through nutrition when it comes to cancer, and how people can use nutrition to support their immune system?
Yeah. And so when I had this idea, someone should create a food guide, and, I just wanted to feel better about what I was doing, because you want to know that you're doing something. And, as cancer survivors, we want to do everything we possibly can. So I kept reading the literature, like the published academic research. And it seemed like everything that I read related to nutrition and cancer kind of fit in one of 3 pillars, let's call it, or keys. And that was, as you mentioned, the first one was supporting the immune system. So let me just show you the guide that I created. So it's the Cancer Risk Reduction Guide.
That's great.
And it's basically, it's like a food guide, right?
It's fantastic. Yeah.
And so here's the bit that talks about, it's always hard to do this because it's reversed.
Yeah. There it is.
System, reduced chronic inflammation, or anti-inflammatory I have there, and the nutraceuticals. So let's talk about inflammation.
Yes.
So, for years in cancer treatment, they've had the 3 tools, which are surgery, radiation, and chemotherapy. But the newest kid on the block that is creating a lot of excitement are the immunotherapies.
Yes.
And what these immunotherapies do is use your own body's immune system to go after the cancer cell.
Right.
And so, coming from, kind of trying to get to that same endpoint, but coming to it from a nutrition standpoint, there are nutrients that, if you are deficient in, will compromise your immune system. And there's other lifestyle choices that you could be making that could be affecting your immune system. So I go through those in here. So for example, vitamin E is very important for the immune system. And what foods have vitamin E? Well, wheat germ and almonds. and, you know, sunflower seeds. So, you know, for example, I switched to almond butter. I use almond butter if I have something on my whole grain bread in the morning. Vitamin B6. So I eat lots of chickpeas and lots of hummus and a fish oil. So I make sure I cook salmon at once a week. And then sometimes if we have leftover, we have it twice. Probiotics. So if I'm in the yogurt section, I always look for probiotic yogurt because, you know, some yogurt, even though it's all made with starter culture, it's not all probiotics.
Right.
So I look for that. That's another thing that's good. Prebiotics. So if I can get any grains that have had a prebiotic fiber, or I use lots of onion in my diet, lots of garlic, I use bananas. And then another thing is beta glucans. So beta glucan is a type of fiber. It's in mushrooms. It's also in barley. That's why if I bake, I use barley flour when I do baking. So there's lots of little things. And then in my mind, I can just go through this checklist and I can, you know, remind myself, you know, I'm doing things, and it helps to reduce the anxiety and the fear, because I know that there are things that can be done to reduce my risk, and I'm doing them.
Yes.
And then in addition to that, in terms of lifestyle, getting 7 to 9 hours of sleep a night, laughter. So laughter can raise your natural killer cells, which is one of the immune cells, managing stress. And this is interesting because when my cancer treatment finished and I had so much anxiety and fear about my cancer coming back, that was stress. And ironically, it was kind of opening the window for what's actually most important.
What you were afraid of. Yeah.
So you got to get a handle on that.
No stress. Yes.
Healthy body weight, spending time in nature. So those are all part of supporting the immune system.
Yes. It's so funny that you say that, the sort of the anxieties. I actually had a lot of anxiety around my diet when I was first diagnosed. And I was worrying about like every single thing I was putting in my mouth. And my naturopath had to say, like, you know what, the stress you're causing yourself over, you know, like whatever little thing you ate that you're afraid you shouldn't is probably worse than whatever little thing that was that you ate that you think you shouldn't have eaten.
Right.
And I just, I really needed that to because it's true. The anxiety is just so much stress, and that impacts us on a physiological level so much. Yeah, absolutely.
And a lot of this too, I find, is it's about taking back control. You know, when you're diagnosed with cancer, it's a big part of it for a lot of people is you feel this loss of control. You don't even have control over your own body. Your own body growing this weird tumor, right?
Right.
So, you know, deciding what to eat is a way of taking back that control.
Absolutely.
Which I think is part of the healing aspect of it.
Yeah, I couldn't agree more. 100%. Yeah. Okay, so number 2 is reducing chronic inflammation. And I know this one is huge because I know personally that cancer loves inflammation. So what role does inflammation play in the development of cancer? And then what can people do? Like, how can nutrition be used to reduce our inflammation?
So, oh my goodness, I read so much about inflammation. Actually, I have a really good blog post on it right now.
Oh, awesome.
On my website, and I have this handout that people can print off.
Perfect.
But think of inflammation as the environment inside your body. And it's an environment that encourages cancer cells to just come into being in the first place. And then instead of them dying off like a normal healthy cell would, they continue to live.
Right.
Let me just show you this is an image I had created for my guide.
Yes.
This is the life cycle of the cancer cell. So it starts with initiation. So the thing about cancer cells is, in the most cases, it's our own body's cell. It's not a foreign cell.
Right.
Like, okay, it is for HPV, and there's a few other virus-associated ones, but the majority of cancer cells are our own body cells. And it does this switch. So a cell that has a normal DNA and will have a normal lifespan switches and becomes this cell with DNA damage.
Right.
And what that DNA damage does is it keeps it growing. So once that initiation bit happens, then that cell survives. So all cells should have a normal life cycle in which they die off and they replace
Right.
themselves with healthy daughter cells. Well, in this case, it doesn't do that. Then the cell multiplies, then it invades the tissue, then it goes through angiogenesis, which is, if you think of angio means a vessel, right? So like an angiogram or an angioplasty, right? And genesis, just like in the Bible, it's the creation of new. So it's the creation of new blood vessels. So now that tumor has blood vessels
Eating it
directly. Yeah. So it's got the oxygen it needs, it's got the nutrients, and then the last stage is metastases. So inflammation plays a role in a lot of these, especially the first, the initiation, the survival, the angiogenesis. And so we want to change the environment inside our bodies. You've probably heard that everyone has cancer cells in our body. But for some people, they're just dormant. The immune system keeps them under control. And others, they grow to become tumors, right? Well, one of the reasons that happens is if the immune system is compromised. Another one is if there's inflammation inside the body, that encourages that cancer cell to keep growing. So changing that environment inside the body can help to protect you.
Wonderful. And what are some maybe anti-inflammatory foods that people could include in their diet to help do that?
Okay. So the number one, the strongest anti-inflammatory is omega-3 fatty acids. So when you hear that, probably a lot of listeners are thinking salmon, and you're right. Salmon, sardines, herring, mackerel, rainbow trout, anchovies. So all the cold water fishes. That's probably number one. And then the spices are actually really important here too. So your turmeric, your garlic, your ginger, your onions, sweet potatoes, those like orange colored fruits and vegetables, fiber-rich foods. So if you want to think of a dietary pattern that represents that, you think of the traditional Mediterranean diet. Now, you don't necessarily associate salmon with that diet.
Right.
They do eat a lot of sardines. And that's their source of omega-3 in the Mediterranean Sea.
Right.
But, think of that traditional Mediterranean diet. And, otherwise, you might describe it as a plant-based diet.
Right.
Right. It's a lot of plants. It's whole foods. It's not processed foods.
Nothing processed.
And fewer animal products. It doesn't mean you have to be a strict vegan or vegetarian, but the majority of what's on your plate is a plant product.
Interesting. And how many, because I know there are people who are nervous about animal products. How many times a week would you need to eat fish to get that level of omega-3 fatty acids?
Okay, so the big omega-3 guru from the University of Guelph, Dr. Bruce Hollub, he recommends 2 servings a week.
Okay. Good to know. Okay.
And in my case, if we make salmon for dinner and we have it for leftovers.
Yeah. Easy enough. Yeah, and that's about you. As I'm thinking about it, that's usually about what I have too. Probably 1 to 2 times a week at least. Yeah. Okay, and the last one then is where's the last one?
The nutraceutical.
Yes, foods that act against cancer cells. So, what are some of the mechanisms that through which food can act on cancer cells? And then what are some examples of those foods that target them?
Okay, so if we go back to that life cycle of the cancer cell, you see that word there, nutraceutical. So that comes from, nutra comes from nutrition, ceutical comes from pharmaceutical. So it's foods or nutrients that have a pharmaceutical action.
Right.
And so this comes from the laboratory research in which they're using live cancer cells. So they might have breast cancer cells or lung cancer cells or colon cancer cells in a petri dish, and they introduce extract of garlic or ginger or green tea or citrus or blueberries.
Right.
And then they examine through the microscope, they see, well, what happens in the life cycle of that cancer cell? And now for example, some of those nutraceuticals will stop the initiation. Some will stop the cell survival. Some will stop the angiogenesis. And some have more than one place in that life cycle where they act. Now, we don't know for sure 100% that just because these nutrients can do this in the laboratory, they can do it in our body. But it's I'm willing to.
It's a safe assumption,
Well, it's kind of a safe assumption because we have some evidence to support that, which is when we look at these big epidemiological studies where
Right.
they collect data on
Data.
people, and they can say who gets cancer, who gets heart disease,
Right.
and then they look at their diet records. What are they eating? Well, it's the people who are eating more fruits and vegetables
Absolutely.
that have lower rates of cancer and heart disease.
Mm-hmm.
So the main foods there are your bright colored fruits and vegetables, your tomato products, your berries, garlic, onions, and probably the superstar in all of that would be broccoli.
Yes, sulforaphane.
Yeah, exactly. Sulforaphane.
Wonderful. Okay, great. Those are some really great suggestions for people. And I think in general, if I'm just sort of recapping, if people want a general, guideline, we're looking at whole foods, whole grains, nothing processed, as colorful as possible, and a heavier emphasis on plant-based foods versus animal products.
Yeah. And, it doesn't necessarily, I wouldn't say, yes, colorful is good, but I wouldn't say, oh, okay, mushrooms are white,
Right,
they're bad,
right.
right? Because there are definitely, and onions don't have a lot of color.
Yeah, garlic, true, ginger.
Yeah, so
Yeah.
I wouldn't go, I know that's a certain aspect of it, and that's
Right.
certainly, I would say, most important in the anti-inflammatory
Yes.
category. But
It's
yeah,
not the only thing.
lots of fruits and vegetables and herbs and spices. When people think plant-based diet,
we forget
about the fruits and veggies, but
Yes.
I'm a big one for herbs and spices. And in fact, I'll often put out a challenge to my client and say, I want you to have at least one herb or spice at every meal. And I recently finished a cookbook. I had to do recipes for the book, and it was perfect timing because I needed, rosemary. I ran out to my little garden. I needed basil. I needed parsley. I needed sage, and I had it all fresh, and it was such a great time of year to be tasting all these recipes. Yeah.
Wonderful, wonderful. Good reminder. And I just, on that note, just want to remind people to post your comments, post your questions, and we'll get to them at the end. Wonderful. Okay, yeah, good. Don't forget the herbs. That's great. So I feel like diet, and just from speaking with people and from my own experience and my own research, diet is one of the most difficult things to choose when it comes to cancer, I think, because there's just so much information out there, and a lot of it conflicts. Like, there's a lot of opinions, and a lot of them conflict about what to eat. So for example, like the two in my mind that always come to mind is keto and vegan, because like a therapeutic keto diet is a really popular choice for some people after diagnosis, and so is vegan, but they're both very, very different diets. So do you believe that there is sort of a cancer diet out there like keto or vegan that everyone should be doing, or not? And what are your thoughts on, like, these two choices that are so popular for a lot of people?
Yeah, I don't know that there's necessarily a one-size-fits-all solution. However, most of the research supports what I just described, like that traditional Mediterranean plant-based diet. When it comes to keto, and I'm a big research person, okay, so I have, that's part of my training. I did my university degree in nutrition, and, just being a registered dietitian, the emphasis from our professional organization is something called evidence-based practice. So I'm reading research all the time. So when it comes to keto diet, most of the research in that is as a therapeutic diet during treatment, and most of the research is on the brain cancers, the glioblastomas, for example. And there does seem to be some benefit to stabilizing the size of the glio so that it's not growing by using keto. And it makes sense because, if you think about the three macronutrients, you have carbohydrate, protein, and fat. And they all will break down. Okay, so carb breaks down into sugar or glucose, protein breaks down to amino acid, fat breaks down to fatty acid. Of those three, the only one that can cross the blood-brain barrier and provide fuel for the brain is carbohydrate or glucose. And so if you are on a ketogenic diet, what you're doing is, reducing your glucose so that the body has no choice but to start burning its next favorite fuel, which is fat. And the byproduct of fat burning is these ketone bodies that are produced. Now, ketones can also cross the blood-brain barrier. And the idea is that the ketones can fuel the brain, but they starve the cancer. And so for me, it makes most sense. And because I have a virtual practice and I work with people one-on-one on the phone who have cancer, those are the patients that I will actually say to them, have you heard of the ketogenic diet? You know, what do you know about? You know, for my other clients, I've certainly worked with ketogenic diet. You know, for example, I had a man who had thyroid cancer, and he was already doing ketogenic diet. He just wanted me to kind of make sure he was doing it properly and everything was okay. Now, based on the research, he's not someone I would have said, I think you should do ketogenic diet, because there's not any research on thyroid cancer. Diet. However, he was doing it. He was feeling good.
Yeah, liking it.
You know, he was just coming to make sure, you know,
get his bases covered. Yeah.
Yeah. So I'm not, I don't think it's everyone should do this. And also because some people find it really hard.
Really hard.
You know, and I like to put myself on the various diets to try them out. So that I know when I'm talking to my client what it's like. And but that wouldn't, you know, and so I didn't have I wasn't really compatible with the ketogenic diet.
Me either.
But that personal experience, I'm not going to let that bias me.
Right.
Someone who says, I really want to do the ketogenic diet, I'm going to go, okay, let's do it.
I
want to know why and what your expectations are and all of that. But, you know, I think it has merit. I think there's some studies that show it can reduce inflammation. There is definitely lots of research showing it can help with weight loss. And if you are overweight, particularly if you have a lot of your excess body fat in your abdomen, that's inflammation, because that's visceral fat. So you can certainly make a case for it as a cancer risk reduction diet outside of that therapeutic, you know, brain cancer situation. The vegan diet, the thing with the vegan diet, it's all just about your perception of what that is, because for many people, a vegan diet the focus is more on what I'm not eating, and I'm not eating animal products. So for example, you know, French fries and a Coke could be vegan. Right. But if you're doing vegan, in which you're having what we talked about earlier, whole food, plant-based diet, but you're just not having any animal products, I think that's a super healthy approach.
Okay.
And I've even had clients who'll take it a step further and go to a raw vegan diet. I think that's healthy. Now, there's just a couple of examples of foods that are better in the cooked form, and you mentioned one already, which is sulforaphane. So you get more sulforaphane from your broccoli when you cook it.
Oh, cool.
So
I didn't know that.
Not, because there is that belief in the raw community that everything is better raw.
All the nutrients. Yeah.
So that's one example. And so you don't need to cook it a lot, but even if you just boil it 1 minute, 2 minutes,
like blanch it.
Or steam it 3 to 5. That's all you need, but that helps your body get the sulforaphane out.
Interesting.
The other one is the tomato products. So you often hear about recommending 5 processed tomato products a week. They do that a lot for men because it's shown the lycopene, which is the main nutraceutical there, to be particularly targeted against prostate cancer. So, but other than that, you know, a vegan diet, as long as vegan means for you, you know, lots
healthy vegan.
Not French fries and a Coke.
Not French fries. Good distinction for sure.
So
I mean, as we were just saying, you know, sort of everyone's a little bit unique, and I agree in that there's not sort of one diet that fits everybody. It's what works for your body, what you can maintain, and, you know, what you feel good on for sure. But are there any sort of key things that people should be including in their diet for sure? And then on the other hand, are there any key things that like everyone would do well to avoid completely in their diet?
Yeah, so the vegetables have got to be in there. And even with keto, you know, there's some people I feel like keto for them is just an excuse to eat a lot of bacon. Right. Okay, so, you know, but keto really, there's a lot of low carb vegetables. Like if you think of all the lettuce greens and salad greens and radishes, and so many of those things. You want to have a lot of those, and then you want to have healthy oils, right? Extra virgin olive oil or any of the high oleic oils. If you want to read more about oils, I have a really comprehensive blog post that talks all about the oils. So yeah, the vegetables can be on any diet that we talked about: keto, vegan, Mediterranean. That's got to be key. The herbs and spices, because again, they don't have a lot of carbohydrate.
Right.
So those really have to be there. In terms of what shouldn't be there across the board, I would say the strongest wording that comes from the World Cancer Research Fund would be with the processed meats. So the bacon, as I mentioned, but cold cuts and the processed meats with nitrates.
Right.
That's where they use stronger language, such as the word avoid, as opposed to limit. Right.
Mm-hmm.
So that you have to be, very stingy with. Also, now most of the research around that is related to colorectal cancer.
Right.
But I find even if my client didn't have colorectal cancer, they still want to reduce any risk.
Right, exactly.
The way I think about it is there's something about the environment inside your body that allowed that cancer to grow.
Right.
Whether it was breast cancer, lung cancer, what it was. So, you want to kind of reduce all your risks.
That's right. Yeah. Check as many boxes as you can.
Yeah.
For sure.
And honestly, when it comes to cancer research, it's kind of a popularity contest. And there are some cancer types that are more common that get more research dollars.
Definitely.
And it could be that your cancer type maybe is a little rarer. You just have all the lines for the other cancer types because we don't have enough data to say, for something rare like gallbladder cancer, what to do, or something.
Yeah, good. Yes. Okay, wonderful. And I know this is a question that we get a lot. What about during treatment? Because I know for me, I went to a chemo class beforehand, and it was very unhelpful in terms of food. They said, eat what you can have. If that's pizza, that's pizza. If that's ice cream, that's ice cream. Luckily I had, already done my research, so I knew not to do that. But are there, some foods that people should maybe emphasize during our conventional treatments? And are there any that we should be avoiding during treatments?
Okay. So this I really individualize. And so my response to this is it's very symptom driven.
Okay.
So a lot of my breast cancer clients are in this category. So if they, their appetite's pretty good, they don't have too much nausea, then absolutely follow this guide and do this. Because yes, you're getting the big guns, you're getting the chemotherapy or the radiation or the surgery, but why not work with that and go with that? However, that's not everyone's cancer experience. It certainly wasn't mine. Like, I can't tell you how much I vomited during my treatment. It was crazy. And so my book, The Essential Cancer Treatment Nutrition Guide and Cookbook, so it goes through this whole chapter here, managing cancer side effects and treatment.
Wonderful.
So it starts with, oh my gosh, I'm terrible at this camera thing. So there's the first one. Can you see it says anemia?
Yes.
So from anemia, what to eat if you have anemia, what to eat if you have a low appetite, or cachexia, what supplements to take, what to do if you have constipation. And I talk about, is your constipation due to obstruction or is it due to non-obstructive? Because the recommendations would be the opposite. Even what to eat if you have depression, what to eat if you have diabetes, diarrhea. It just goes alphabetically through everything.
That's amazing.
Dry mouth, fatigue, heartburn, food aversion, everything. And then the recipes will say, for example, this recipe is good if you have anemia. Pasta with clam sauce. Well, clams are really high in iron. So there you go.
There you go.
So nutrition can help with some of the side effects. That's for sure. Now, you still may need medication to help some of those side effects, but I think nutrition can help. So, but if you're just feeling lousy and you have a poor appetite and you get nauseous when you smell foods and food doesn't taste right and all that stuff, then honestly, just get through it. Just get
through it.
And don't add extra pressure to yourself thinking, oh, but I have to eat 7 servings of vegetables. I was there and I could not have
I would not
on that guy.
Yeah.
I just had to get through it the way I could get through it. And once I was done and I was feeling better, then I could focus on that healthy diet. But I honestly, I really don't like when I hear nutrition professionals, saying, if you have cancer treatment, this is the way you have to eat. Because honestly, it's like, and even if you haven't had
survival
cancer
mode
before, just think about, you have the flu.
Yeah.
And you have the stomach flu and you're throwing up and you feel crappy. What if someone said to you, oh, well, you have to eat 7 servings of vegetables today and you can't have this and that. And it's like, all you want is comfort food.
Yes.
And, so if you have the appetite and the energy level and you can focus on that cancer risk reduction, do it. But if you can't, don't put added pressure on yourself. Just get through it. Stay hydrated. That's key too. Stay hydrated, because if you get dehydrated, all of those side effects just get worse. So drink and get through it, and then focus on the healthy eating.
Wonderful. Yeah, I know I ate a lot of soup and soda crackers. A lot of soda. I think I went through, I don't even know how many sleeves of soda crackers, with a ton. Yeah, it's just kind of get through it mode. That's good advice. Yeah, especially that added pressure. Yeah,
and you're going to crave things, right?
Yeah.
Like you're going to crave weird oddball things, and
I wanted fries. It was the only thing I felt like eating for like a week.
Yeah, I didn't want. When you talk about pizza, so I was in the hospital. I was admitted for my chemotherapy, and I was in there for probably a week. I didn't eat a thing. Like, I couldn't take the lid off the tray. Like, it would come up, I just couldn't even look at it. I was so nauseated, so bad. And I couldn't believe they were letting me home because I hadn't eaten a thing. And I was actually scared to go home. And, I think it was my first or maybe my second day home, my family ordered pizza. And it smelled so good.
Yeah.
But I want this. And my mother cut me the tiniest little sliver of pizza. And I ate it. And I kept it down. I'm like, oh my God, I can eat.
Amazing.
And, that also happens too, because, you go through the cycles with the chemotherapy, right? In my case, mine was every 2 weeks. So you kind of start to feel normal again near the end. And then you go back. And then it's popsicles. And yeah.
Definitely. Yes. Good advice too. Yeah. And I think it goes back to what we were saying before about, anxiety and stress, and don't put that extra anxiety or undue pressure on you. Yeah, for sure.
I just think that's fair of professionals to do that to people.
For sure. Yeah. Especially if they haven't gone through it themselves too, and they don't know. They don't know what it feels like.
Have you ever had the flu? How would you like it?
How would that feel?
You're not getting better unless you eat this way.
Yes. So this is a really interesting area that I'm about to mention next, and it had never occurred to me that nutrition could play a role in this, but you have a particular interest in lymphedema and how nutrition plays a role in lymphedema. So I guess for anyone who doesn't know what lymphedema is, could you just explain briefly what that is, and then how exactly can nutrition be used to help those who are suffering from it?
Okay, so I have one more thing to show you.
Yeah.
So my book, The Complete Lymphedema Management and Nutrition Guide, which is, I wrote it with Anne Demena. So she's a physiotherapist who's certified in lymphedema management.
Fantastic.
Okay, so what is lymphedema? So I will answer this question in a context of cancer, because people can have lymphedema for a variety of reasons, but because this is a cancer audience, I'll answer in that.
Yeah.
So, and I'll use breast cancer as an example, because that's a fairly common one. So for the people who've had breast cancer, part of the treatment for that, a lot, surgery can often be a part of the treatment. And then what will happen when they do surgery is they'll remove lymph nodes from the armpits. And that is to help reduce the spread of the cancer. And traditionally, what would happen is during the surgery, the surgeon would just visually look at the lymph nodes and just take some out. And that was just called lymph node dissection, I guess. And they ended up, taking quite a few.
Right.
Now they do something a little more sophisticated called the sentinel node biopsy. Did you have a sentinel node biopsy?
Yes, I did.
Yeah. So during the surgery, they'll put blue dye near the breast cancer, and then they'll watch which lymph nodes take up that dye, and they remove only those nodes. And so the end result is you end up getting fewer nodes removed. With the sentinel node biopsy, which is becoming more common.
Yes.
And the reason it's becoming more common is that women after breast cancer are ending up with lymphedema. So what happens if you have the nodes removed from your armpit, then, if you think of the blood vessels in the body, the heart pumps the blood out and the blood vessels go all over the body and they come back to the heart. The lymphatic vessels are everywhere the blood vessels are.
Right.
You don't see them because they're very delicate and the fluid that's carried in them is practically clear. It's like the plasma, basically.
Right.
And so what happens is, as that fluid is circulating through the body, it can't drain properly out of the arm because the armpit lymph nodes are gone. And so what happens is you get this heavy feeling in your arm. You could have numbness or tingling or pain. And sometimes it's obvious, like the one arm is much bigger than the other one. What's going on here?
Yeah.
Now, the thing to keep in mind, if you have had lymph nodes removed or if you have had lymph nodes in the radiation field, and this could be anywhere, could be from ovarian cancer, endometrial cancer, GI cancers, prostate cancers, melanomas, that you have a lifelong risk of lymphedema. Because I have met people who had their cancer treatment 10 years ago and they get lymphedema.
Wow.
Now, what you want to do is prevent yourself from getting it, because once you have it, it's a chronic disease and it involves so much self-care. You don't even want to hear about, all the self-care that's involved. Now, how do you prevent it? You protect the vulnerable limb. So let's say the lymph nodes were removed from my right armpit. It's my right arm that's a risk. So what does that mean? That means I don't want to get a mosquito bite. I don't want to get a scratch. I don't want to get a sunburn. I don't want to get a cut. So I'm going to wear my sunscreen. I'm going to, wear my mosquito repellent. I'm going to wear long sleeves. I'm going to wear gardening gloves when I go in the garden. Because what happens if you get a cut or a burn or something, it's like your body calls cellular 911. Okay, send the first responder. Okay, well, how do they get their white blood cells? And they travel there in the lymphatic system. That's how they travel. And then they get there and then they multiply, right? Because, we've got this injury, lots more first responders. So then you get all this white blood cells. Well, and then they try and leave and they can't. Bridges out. And that's when you end up with lymphedema. So if you had lymph nodes removed or in the radiation field, prevention.
Okay.
You may even want to go see a certified lymphedema therapist, even if you don't have signs of it, just to learn how to do manual drainage, maybe even get a compression sleeve. People aren't traveling so much during COVID, but, it's often recommended that you have a compression sleeve if you're going on an airplane or, even surface travel, not as much, but more so that plane travel, but you want to protect, right? And good skin care and things like that. And even just, if you've had endometrial cancer and lymph nodes removed, then your risk factor would be your legs and your feet.
Right.
So you don't want to be walking barefoot, for example. So just, prevention. And then in terms of diet, low salt diet is very important. Anti-inflammatory diet, which is nice because it reduces your risk of cancer recurrence. It helps with the lymphedema. weight loss is really key, because the higher your body weight, the greater your risk factor.
Okay.
So, weight management, even just losing 5 or 10% of your body weight. What else? Possibly the ketogenic diet, but certain, and the opposite of that, which seems kind of funny, is a diet that's low fat, because the lymphatic system actually transports what are called long chain fatty acids. So the types of fatty acids that are in your vegetable oils. Okay. And that would just add more congestion to the lymphatics. And then the other thing that I'm really passionate about, in fact, my next book, I can't show you the cover because it doesn't come out yet, is on intermittent fasting.
Oh, great.
So that can be a tool that can also help with lymphedema as well.
Wonderful.
It basically lets your lymphatic system clear all the lymphatic, because a lot of it is actually produced in the GI tract. So gives your body time to get that lymphatic fluid where it's supposed to be before you eat again.
Wow, very interesting. That's so cool. I had no idea. I do intermittent fasting too, but I had no idea that it supported the lymphatic system in that way. That's so interesting. Very cool.
Yeah, there's no research specifically on intermittent fasting and lymphedema, but if you it's my recommendation based on an understanding of the physiology and what lymphedema is.
Yeah, absolutely.
Have you had lymph nodes removed?
I did. I had 3 removed. So yeah, a lower amount than some, because they did do the sentinel biopsy. But yeah, I've had 3 so far. No issues yet. But as you say, yeah, it's always a lifetime risk.
Yeah, it is, and it's often, sad to say, misdiagnosed. And I think it's the norm more than the exception. That my clients will come to me and say, well, I've had this for years and no doctor could tell me what this was. And so, yeah, you have to seek out a good healthcare professional who knows about lymphedema if you're suspicious.
Definitely. Okay, so I'm gonna get to we've had a couple of audience questions come in. The first one's up on the screen right now. So when we were talking about omega-3 fatty acids or fats, we were talking about fish. So this question is, what are some vegetarian replacements for fish in order to get enough of those omega-3 fats?
Yeah, the tricky thing with omega-3 is it's not naturally occurring in that many foods.
Right.
So the vegetarian versions would be ground flax seeds, chia seeds, flax oil, walnuts, and foods that are fortified with omega-3. Eggs, I don't know if this is a vegan or vegetarian eating eggs, so the omega-3 eggs, for example. The other alternative would be, if you did want to take a supplement, you can basically eat what the fish eat, which is the algae. So you can get vegan omega-3 supplements too, if you were concerned that you're not getting enough from your diet.
Great, good to know. So Jane is wondering that she's saying, as a dietitian, you probably had a pretty solid diet before you were diagnosed. So what were the biggest changes that you made after you were diagnosed?
That's an interesting assumption.
Yeah.
I think being 27, I think a lot of my belief at the time, as long as I knew what was the right thing, that was okay. I didn't have to do it. So, that I got a lot smarter when I turned 30, let's say. But I definitely took my diet a lot more seriously. What were some of the biggest changes? Probably, I guess, the fruits and vegetables. That's always my thing. Where are my fruits and vegetables? The whole grains. I never drank green tea before, I can tell you that. I didn't like it. And I just keep reading about it and, going through that checklist. I'm doing this and I'm going, yeah. Go. So I acquired a taste for it and now I can drink that.
That's
and just really that focus on the plants in my diet.
Definitely. Yeah, I would say that was a huge change for me too. Yeah, I was lucky if I ate a vegetable a day before. And then on that same line, she was also asking then, if it wasn't diet, then do you have any thoughts on why you did develop cancer at such a young age?
Yeah. Oh, yeah. That's kind of a two-parter there, because the assumption there is that I got cancer because of a poor diet.
Right.
And I would just want people to be careful out there, because I've met so many people that are just guilt-stricken when they get their cancer diagnosis, thinking they did this to themselves.
Right.
And I don't want anyone who's listening to feel that way, because,
absolutely,
as much as we want to give a message that eating properly can help reduce your risk, I don't want the flip side of that to be, I caused this myself and I'm the reason I have this.
Yeah.
So I just want to put that out there. And sorry, what was I going to say about that? What was the rest?
Oh, it was, do you have any thoughts on what did contribute to the development of your cancer at such a young age?
I was very stressed.
Yes. Jane even says that in her comment, stress was a catalyst, she thinks, for her. And me too, I think for me too.
Yeah. I was at a real crossroads in my life.
Yeah. And
just big things going on.
Big.
Yeah.
Yeah, me too. I had a very stressful 3 years leading up to it, for sure. Yeah, so I think that was huge for me too. Yeah. Okay, we have a interesting question here. Is it I'm assuming she's asking, is it safe to consume lime and wheatgrass juice during chemo? This is Ms. Hatton. She's just starting now. So is it will it, because they tell you to stay away from things like antioxidants and things like that, because it'll clear out the chemo drugs faster and they won't necessarily be as effective. So do you know if lime and wheatgrass juice, I guess, falls under that category? Is it going to interact or decrease the effectiveness?
You know what? I would talk to the pharmacist at the cancer center, because, you'd have to look at the particular chemo that you're getting and what are the interactions there. I wouldn't want to say, because it wouldn't be across the board.
Yes.
The wheatgrass, I know from some research that I've looked at that it does seem to benefit in terms of that, the neutropenia that happens on some chemotherapies where the white blood cells drop.
Goes down.
There could be some effect from the wheatgrass that it can help reduce that decline. And the benefit there being that there won't be delays in the chemo regimen.
Right. Oh, interesting. Okay. Good. Great advice. And then we have one more, another from Jane. Is there more specific dietary needs for preventing hormone-positive breast cancer reoccurrence?
Well, the one recommendation that's unique, a few cancers have this, but breast cancer is alcohol. But that's all breast cancers, not just the hormone positive. In terms of hormone positive, you might be surprised by my answer, but I'm going to say soy is beneficial, because people still have this idea.
I've just started including it in my diet again, because I was terrified for the first couple of years. But
so many people are
the
terrified.
more I read,
and honestly, even their surgeon will tell them,
everybody
will tell them that, oh, you had breast cancer or you had estrogen receptor. Oh, you shouldn't eat soy. Oh my gosh. The research on that, that's so, 2008. Come on, people. Stay up to date. And that came from the early animal studies on soy. But since then, there's been several, probably 18 studies looking at estrogen receptor positive breast cancer survivors, and they follow them. Okay, you're in our study. We're going to keep track of you. We're going to find out if you get a recurrence or if you die from your cancer, but we're going to collect your food records. So you're going to tell us what you're eating, and then we're going to analyze it. And what they find is the women who have the greatest intake of soy or the greatest intake of isoflavones, which is the plant estrogen, have the lower risk of recurrence. And this is over and over again. So I would say, don't be afraid of soy. Don't be afraid of flax. Don't be afraid of any of the legumes or any foods that have natural
phytoestrogens,
plant estrogens. And just remember that. And the reason for that is, so estrogen receptor positive breast cancer. What that means is let's say this is your cancer cell. It has a receptor on it that connects with estrogen. So, and think of a receptor like a keyhole. So here's your cell with your receptor, and along comes the key, estrogen, it locks in. And what that does is it encourages it to grow. So let's say the estrogen that comes from the soy comes along and hooks into that. Now, it's not identical to human estrogen, but it looks enough like it that the key can fit in the keyhole. So do you think that's a strong stimulator of growth or weak?
Be weaker.
It'd be weak because it just comes from a little plant, right? Versus if your own human estrogen comes along and
clicks in
there, that's a strong stimulator.
Totally.
So in essence, the plant estrogen is basically blocking the much stronger human estrogen.
Right.
And so that's the theory to explain why these women who consume more soy and more isoflavones in their diet have lower risk of recurrence.
Very interesting.
The other thing that I've read, just one study, and it looked at dairy intake, and what they found was women who consume 1 serving a day of high-fat dairy had a greater risk of recurrence of their breast cancer. So the theory there was that, when they milk the cow, get the natural estrogen that the
of course,
because it's either pregnant or just had a calf. And when they then separate the skim milk and the cream, the estrogen with the
gets
cream
pulled out.
So the high-fat dairy products are the risk factor, and that was only one study. It was a few years ago. I haven't seen it repeated, but take it easy on the ice cream and the cream and the cheese. But you're fine with milk if you choose to drink cow's milk, or probiotic yogurt, or kefir, something like that.
Very good. Very interesting. Yes, I've heard it. It's almost like tamoxifen, how tamoxifen blocks the estrogen receptors on the cells. It's like a similar mechanism that the phytoestrogens do. Interesting. Okay, and we have one more question here from Anna. So a friend of hers, their son has had a biopsy done for a tumor, potentially sarcoma cancer in the, does it say brain, or did I invent that? I may have invented that. But so they're thinking it's a sarcoma. What diet do you have any recommendations for that specific type?
No, not for that specifically.
Okay.
And with a 12-year-old, one of the main focuses of nutrition is you want him to keep growing, right? So, and that's a big focus with kids and nutrition is, those growth curves. You've seen the pediatrician plot your kids on. Yes. That really becomes important. Anytime a child is sick, you don't want them to fall off their growth curve. So it's a matter of just, eating what we talked about before, but where an adult can eat half a plate of vegetables and, a bit of protein, bit of grain, or maybe not any, the kid maybe is going to need more of the carbs and the proteins to maintain the calorie level. Like, you don't want the vegetable get so big that they're not getting enough energy or calories from food.
Makes sense.
Yeah.
Okay. Recommendation. I know we're almost out of time, but there's just something that I really want to ask you.
Okay.
So and it's because I feel just so similarly. On your website, you said that you had no idea that your journey with cancer was going to be such a gift and lead you to your greatest purpose in life. And that's like exactly how I describe my experience. And I talk about the gifts of cancer all the time in relation to my own journey with it. And so I'm just wondering how it's hard for me sometimes to articulate it. So I'm wondering if you can articulate how you reached this place in your journey where you were able to look at cancer as a gift instead of a burden.
Well, I think, when I was talking about that life-changing stuff in my life, that stress, like, it just really put that all into perspective for myself and my family. And I think my mom in particular, just what really was important, because, she thought I was a goner. That was it for me. Because she remembers, because she's a nurse, and she remembers having a young patient who had the same cancer I had when she was a nurse who died. And so she thought, oh, that's it. And then when I pulled through it, I made it. It's like, well, nothing else is really that important. You know? So yeah, it's given me that. And I think although I was a dietitian before I had cancer, I feel like I can be more in integrity, right? And just, that person's question earlier, well, I assume that because you're a dietitian, you had a good diet. Well, that, thank you. But now I feel like, okay, I can be in integrity with that. And I don't like to hear myself say to somebody else, oh, well, you need to do this.
And then not do it. Yeah.
Not do that so well, like I try and follow my own advice.
Right. Yeah. Wonderful.
I think people know, like, I think then they can tell that it's genuine.
Absolutely. Yes. Yeah. They can absolutely tell it's genuine. And I think it helps to, like, how we were saying before, if someone suggests, you eat a certain something, but if they've not gone through it and they don't know what it feels like. So yeah, I think I would assume that it would help to sort of relate to your parents or your patients and connect to your patients and, and make that part a little easier.
Mm-hmm. I remember working in a health club with all kinds of personal trainers, and we'd eat lunch together, and I could see what they're eating. I'm thinking, tell your clients to eat that. And I feel like I have more respect for the ones that I could see that I know that what they're eating is something that they would tell their client to eat, right? And I feel like I can respect that, and I try to do the same, and I'm like always taking the stairs, and I think it's helped to align me better with my profession, and I can practice more in integrity.
That's a really good description. Wonderful. Well, Jean, we've very quickly filled an hour, and I just want to I want to thank you so much for being here and for sharing your expertise. It was really informative, and I'm sure very valuable for everybody watching. I learned a lot. I'm sure everybody else did as well. And for everyone who is watching, thank you so much for being here again for another episode of Empowered. And Jean, if anybody wants to find out more about you or work with you, where can they go to find that information?
Yeah, thanks. They can just go to my website. That's probably the best place. And lots of stuff on the website. My blog is on there.
Yes.
You can see about my books and my guide, and then how to work with me if anyone wants to do virtual sessions. Yeah.
That's fantastic, which is perfect for right now while we're all
absolutely. I was kind of doing virtual before, so now it's like I find more people are open to it.
Of course, absolutely,
very effective,
Very effective. That's great, wonderful. And if anybody would like to find out more about me and what I do at Arenda Cancer Community and Blog, you can find us on Facebook. Just search Arenda Cancer Community FB for Facebook group, or go to my website arendablog.ca. And if anybody doesn't know by now, Empowered is brought to you by Cancer Warrior Canada Foundation, or Cancer Warrior Foundation Canada. And they do a lot to raise awareness about early detection and prevention. They raise funds for research. And right now, during COVID, they're helping families in need who are finding this time particularly difficult. So if you or anybody that you know needs some support or some help, you can call the number that's going across the bottom of your screen now, or you can contact them on their social media, and they'll be able to get some help out to you. So Jean, thank you so much once again for being here. It's been absolutely fantastic. And for everybody watching as well, make sure you're following Cancer Warrior Canada Foundation on Facebook and YouTube so that you don't miss our next episode. And take care, everybody, and have a really wonderful night.
Bye.
Bye.